Hi, this is Dr. Dave Elwell, and I'd like to welcome you to another video. In this video, I'm going to try to focus on a topic of abdominal pain. And I also want to make sure that you understand that where you can get a lot of good quality information on abdominal pain. I have people that come into the emergency room on a frequent basis, and they've often already looked on the internet to try to get some clarity on their symptoms. Frequently that has caused more problems than it has helped them, because there's a lot of information on the internet that is of questionable value, but it does get people pretty worked up, pretty nervous, and it creates a lot of concern about other diagnoses that they may have. So one of the things I want to tell you is be very careful about where you're getting your information from. I can tell you that VitaPillars.com is a new website that has a lot of really well put together information on specific health topics, medical complaints, where you can go and investigate, do a little bit of research, and know that the information that you're getting is really quite reliable. My goal in contributing to that is to try to give you some insight on health topics that a lot of people deal with and that I see frequently in the emergency room. And not to tell you how to diagnose yourself or necessarily to give you solutions right through this video, but to give you some things that you can think about and try to focus on those things that are often not told to you or might be missed as a result of where we are with the hubbub and the overburdened healthcare visits that we have today. One of the ones I want to talk about right now, it falls under abdominal pain. Let's really quickly talk about abdominal pain, and I will go into this in more detail when I talk just about abdominal pain, but frequently people will have a abdominal pain that's up high in their belly. They often will describe it as a burning pain. They may have some sense of burning going up into their throat. It can often happen after eating food, and if they have this on a recurring basis, they may have the diagnosis of acid reflux. Now, acid reflux can present a lot of different ways, and you can have acid reflux symptoms and the actual diagnosis isn't typical acid reflux. For example, many of you know, and if you don't, you can go to VitaPillars.com and understand how the stomach and the esophagus are connected. There's a way that the stomach tries to prevent food and fluid from going up into the esophagus. True GERD, or gastroesophageal reflux disease, is those symptoms that occur when food and some of that acid fluid moves up past that sphincter in the lower part of the esophagus, gets up in there, and some people even say, boy, I almost felt like I had a little regurgitation that burns the esophagus and gives those classic GERD or reflux symptoms. Having said that, not all symptoms that feel like that are just because of a problem with your sphincter between the stomach and the esophagus. What I want to talk about briefly here today are a few things that can actually mimic that. Number one, a heart attack can mimic that. Having said that, though, a heart attack is something that when it comes on, it usually stays, and it isn't as much a come and go burning symptom, but it can be, and you have to be aware of that. If you have a persistent sudden pain in the chest, you may need to go directly to the emergency room and get that looked at. If you're someone that has recurring symptoms and with your healthcare provider you've come to the conclusion that this is more of a stomach symptom, you may get put on medication to try to cut the acid, and that may or may not help. One of the things that I find when people come in and they've had many different medications and they've had a recurring diagnosis of acid reflux, One thing that they haven't considered is whether or not they're having a food intolerance. Now, a food intolerance, sometimes people will refer to it as a food allergy. It's not the same kind of allergy that you might get with with poison ivy, or you take a medicine and you get an allergic reaction. It's a different kind of intolerance. It can cause a aching pain. It can cause a slowdown in your stomach that can cause nausea. It can cause that reflux symptoms. And the number one food that causes that, or the number one food, if you take all people who have some kind of a food intolerance, the number one culprit is milk products. Now that doesn't just mean drinking milk. That means it could be any kind of milk product. And depending on what study you look at, some studies will suggest or will conclude that as much as 30% of the population have an intolerance to milk. I'll give you my personal story. When I was a intern, and I was working hard in the hospital, often didn't have time to eat, and I frequently was going into the food that was available for patients and grabbing some graham crackers and a carton of milk. And I was kind of living on that. Well, I didn't put it together, but I was having tremendous, terrible gastric reflux-like pain. And in fact, sometimes when you get it really bad, some people will tell you, this is a terrible pain. It feels like a heart attack. You can get an esophagus spasm, and those people usually end up in the emergency room. It can mimic heart attack. And I was getting those pains, but I was pretty sure that it was reflux. I would take something to drink, like Malox or Mylanta, and it would help to settle it down just a little bit. I went and had an upper GI scope done. They said it all looked pretty good. I had a trial of medication. It seemed to help a little bit, but nothing really did it. Finally, I thought it has to be something that I'm eating. And I did a little research and found the frequency of problems with milk. I stopped milk and any cow milk products, and sure enough, within a couple days, my pain was completely gone. I stayed off of all milk products for quite a few months. In fact, I was afraid to have milk products, and then I started being able to have some cheese and yogurt, and if I drink milk or if I eat consistently eat cottage cheese, all of those symptoms will come back, and they will come back consistently. I have shared that story with patients frequently over the last 20 plus years as an emergency room physician, and it rings true for many people. So here's my suggestion, and I'll talk more about acid reflux in another video. And again, I suggest that you look at VitaPillars.com, where you can get just some of the basics, things that you can try to do to try to help mitigate that reflux. But consider the possibility that if you've tried all of those things and you keep having that pain, consider the possibility that you could have a food intolerance. I recommend taking a period of stopping all milk products. Keep in mind that if you're not going to have milk products, you need to get your calcium and your vitamin D in particular from another source. Doesn't matter what age you are, you need to have a consistent source of calcium and vitamin D. We also have solutions for that on VitaPillars.com, where we have an excellent way to get that resource. But please keep in mind, try the milk. Try it for at least 2 weeks. And if that doesn't work, then you could try another food. With that, I'm going to close today. I really appreciate you coming in. I hope that works for you, because I've gotten feedback from people that has completely changed their life, and that they've realized that's been a problem for them for years, and they suddenly become pain-free and they're able to control that. So with that, I'm going to sign off. Thank you very much for coming and listening to this, and I wish you much health and happiness.